And we're back. Sorry, wrong show. All right, everybody, welcome back. I know it's been a long time since we last spoke, but we're ready to dive back into another reaction of the Pitt. This is 12 p.m. We're getting close to lunchtime. I'm Dr. Todd, by the way, so I got it in the beginning. So the joke there is I always forget to introduce myself. This is my wife, Allycia.
Hello.
So we have kind of a good excuse, I think, for it taking a while to get back to this.
Kids are out of school.
Yep. And we just got back from Disney World. So it took a week to Disney. So we're refreshed.
I don't know about that. It's pretty exhausting.
Actually, not refreshed at all. But it was fun. I guess if you're out there watching, your Disney fans, comment favorite ride at Disney World. We'll tell you if you're right or wrong. I'm kidding. My favorite is probably Tron.
Is it? Over Tower of Terror?
Yeah, they're both really good. But Tron, it's just too short. Those of you who've rode it, you get what I'm saying. It's too quick, but it is a very good ride. I know you like Cosmic Rewind.
Yeah, that's my favorite.
The Guardians of the Galaxy are also a very good ride.
Even though I don't like roller coasters, really. Those ones at Disney are a little different.
Yeah, their engineering is like, it's next level. And then Tiana's Bayou, another good ride. But anyway, enough of that. For those of you who are new here, thanks for checking us out. Please consider giving us a subscribe. Help us grow this channel. If you're coming back, thank you so much. We're happy that you're hanging out with us again. Again, from the last episode, we had a lot of amazing comments, really supportive comments. And actually, a couple of people took the time to help write out like all the characters and what level they are.
Yeah. That
was super helpful. I mean, obviously we could have Googled it, but
even though I'm horrible at names, the guy that we kept thinking was a first year is actually a med student.
Yeah, Whitaker.
That's right.
So we were debating that because they called him a student doctor, and I was a little thrown off by that because you do hear that used a lot. Like medical students are oftentimes referred to as student doctors, even though not technically a doctor yet. But that's not an uncommon term. But he's done so many like hands-on things that probably more than you typically see medical students do, especially like in one shift. So I feel like he's almost operating more at like an intern level. But he is a medical student. And then I think her name's Victoria. She's a third-year medical student, which I think we kind of knew that she was a med student.
It's hard to say though too, because you did your training in Australia. It is very possible that med students here.
Yeah, well, and they do like
could do it a little differently.
You can. Well, no.
Well, you did 2 years.
No, I did my clinical training here in the United States.
Okay,
so
that's
that would not have been any different. So I would have been in 3 and 4, just like they were in the. So yeah. But anyway, I think the last episode was a little less sad, a little less heart-wrenching. I assume that's going to change. We got a little bit of like caregiver fatigue, caregiver burnout. We have some kind of weird thing brewing with Santos and then Langdon, right? Langford. The senior resident.
I got our kids' names down.
Yeah, there you go. Something with the Ativan there. So we'll see if that kind of comes back on. But yeah, I don't know. I'm going to make some notes as I tend to during this episode to see if there's anything we want to circle back to. I guess without much more, let's dive in. All right.
All right, let's go.
Fun weekend with
episode
your
6.
All right, I was trying
12 p.m.
to
So we're getting
help.
close to lunchtime,
Helpful.
which isn't really a thing in the hospital. You eat when you can. I've been kind of caught in the crosshairs of family arguments before too. It's a very uncomfortable position to be in.
I can imagine.
Good work. You kept
He needed to hear that.
Yeah.
Come on, that was all you and
He needed
Dr.
to
Robbie.
win.
For sure.
Business school or medical school?
Both. Hopefully, we'll get a chance to work
okay.
together soon, Dr. Rabinovich.
Want to keep the CD, improve metrics. There's a lot of OFI.
Yeah. I have all kinds of opinions on this.
You gonna write it in your notebook?
I don't know that I have to.
Opportunities for improvement.
Well, you could have just said that.
OFI. I've never heard that term.
We will explore what ECQ has to offer.
This is bullshit.
What's ECQ?
That's the company that.
Oh, okay. Missed that. Oh, she's just gonna bypass
And
that.
Ginger's daughter.
You should consult with Kiara.
Is that not behavior? Is it behavioral health? Kiara?
Oh yeah, I think she's the behavioral health consultant.
Renovations you're going to be doing in the next couple of weeks are the kind you watch on TV.
You tell my wife that.
That's not always easy.
Unrestrained
So
driver of
these
the
are
stolen
ambulance
ambulance.
people?
Right chest, left leg injuries. 105/70.
Can I go with him?
Is your friend?
He's my pledge.
We're going to find a room for
So this was some kind of like
fraternity.
Like initiation or something.
Really dumb.
Yeah.
All right, Miles. It's gonna hurt for a second. You ready? Mother!
That's a good sign.
Injections.
No, all set.
Like or,
How bad does it look? What have we got?
what's that called?
Like filler.
Yeah. I feel like that curtain probably should have been back.
Complications from silicone butt injections.
So call the clinic that did it.
She found the guy on TikTok. He did the injections in his living room. She thinks it was maybe silicone cock from Home Depot.
Oh, gosh.
While comparing surgery to antibiotics, it showed that without an appendicolith, there was a 75%.
He's recognizing the tension in the room.
Hello? Oh, yeah, I'll be right there.
She doesn't like the tension.
Grant. Nobody, I made her
Oh,
up.
that was nice of her.
Yeah.
Sorry.
Is she considered a medical student then? She's not, right?
No, Santos is not. Santos is an intern, and then the other girl here is, I believe, surgeon.
Okay.
Space, anterior axillary line. Perfect. Nope, you're not gloved. I got this. On my own.
Just two with a scalpel hanging out of your foot.
Glove up.
No, she have to have an HIV protocol and all that, or I don't know how that works.
Yeah, I mean, now she's going to have to go through some testing for infectious diseases and communicable illnesses.
You know, I told the daughter, I told her to take a break, you know, to prioritize herself. And I didn't think that she was going to dump her mom.
You know, I mean, telling someone to prioritize their own health is not wrong.
Abandon them either.
Right. And
Yeah.
conflating those two things would be incorrect.
No blood flow past the brainstem. Okay.
Any news?
There is. Why don't we step outside?
Why would, I don't know. Would it be inappropriate to say it in front of him? If he,
I don't think so. I don't
are they
know
going
if
to go
he's...
into a consult room or something? Okay.
Yeah.
All right. That makes sense.
Which is more appropriate than doing it out in the hallway.
Yeah.
He's brain dead. I am so very sorry.
Is that Dr. Robbie? You owe me a dance.
You ever dance with a patient?
No, I have not.
I assume you've never thrown a scalpel into somebody's shoe.
No, thankfully I haven't.
Had one thrown into yours? Anybody you know how that happened to?
No, but I'll write down a story about something.
Okay.
57 gauge needle.
The woman just staring.
Think mom will consent to Christy terminating the pregnancy?
A woman should only have a child if she wants to.
Well, if you had just gone with Abbott's measurements, they would have been discharged an hour ago.
Did he just say that if she would have calculated the mismeasurement correctly? Or something?
Well, she's saying if she had gone with Abbott's measurements, which were the initial doctor that we met on the rooftop, Dr. Abbott, if he had taken measurements that suggested that the pregnancy was earlier, likely to allow the patient to still obtain the abortion based on the legal statute. And then when Dr. Collins took the measurements herself, they contradicted that.
Yeah,
And
but then
so-
he lied for her, right?
Right.
He said, I will say that the
Right.
measurements are this. But then just said, if you had went with the mismeasurement, then we wouldn't have this problem.
So kind of gaslighting her.
Yeah.
Which is not appropriate. Obviously, she followed what was medically accurate, which I know sometimes that obviously this is pointing to a pretty socially provocative topic. And there's obviously going to be I think it highlights though in medicine, like when you take your oath, like your Hippocratic oath, it doesn't matter who the patient is, what their beliefs are, what they've done wrong. It could be a murderer. You're supposed to, by your oath, provide the same level of care, high level care to everybody. That doesn't mean obviously that you don't hold strong, emotions or feelings or even resentments and things like that. You're not supposed to, but obviously we're all human at the end of the day. Yeah. But yeah, so that wasn't a fair thing to say to her. To say, hey, like if you had just basically lied, then we wouldn't be in this situation. Like that's not a fair statement.
Get kicked or hit with a ball or anything?
No, it just came out of nowhere.
Testicular torsion.
Probably.
Winning the whole thing.
So Collins won, huh?
You guys ever find out why those kids stole the rig?
Undeveloped prefrontal cortex.
Took me a minute to get that.
I have Joseph Marina's CT results.
Neurocysticercosis. Be gentle with this one. Patients don't usually handle this diagnosis very well.
Got it. Neurocysticercosis. This jogs some memories. This is a pretty rare disease. I want to say, if I'm not mistaken, it's related to like eating, I don't know, like pork, like bad pork or something. Like it's one of those like medical trivia, like textbook things that you learn about. I never heard of one in real life, but it can cause seizures and all the like. So yeah, this will be interesting. So I know we've not watched the show House yet. We keep getting comments on House, that being a show that supposedly kind of chases those zebras. Zebras meaning very rare medical things. This would be an example of that. If this neurocysticercosis, but they'll probably educate us a little more, maybe even more better than I just did there.
It's really important that I try and fix this now.
Do they do it manually? Not with surgery?
I would imagine that would require
Inside, so we rotate
surgical
outward by
procedure.
opening the book.
Yeah, she's doing it manually.
Testicle might have
I
twisted
guess maybe
other
if
way.
it doesn't work.
Yeah, I don't know. I mean, I've never had to fix a torsion.
That's good. We need to admit to urology. He'll need minor surgery to tack it down. And you have a great relationship with your son.
So she's going to have a son.
Sounds like it.
Larva from a pork teat,
Pork?
but it's dead and long
Yeah,
gone. What we're
right on
seeing
that.
Yeah.
on the CT is scarring around those dead cysts.
Dead worm eggs.
Larvae.
I mean, it's not funny, but it's. I think
I know.
his Dr. Lane's kind of approach, I think.
Yeah.
So there's going to be a worm graveyard in my brain forever.
Yeah, but they're resting in peace.
Medical humor.
Devastating personal loss can be very hard to manage on your own. It's okay to need help.
A little ironic, though, right?
Yeah, right. But that's asking a doctor to seek medical help. And what about you, Dr. Robbie?
Let me get you some anti-nausea medicine.
Okay, fine. I never did meds, but sure.
Wow.
What did she say?
I never did meds, but sure.
Oh, wow.
We're also talking about a child.
Which is immediately makes it high-risk pregnancy.
Could he die?
His condition is serious, but it's stable now. Would you like to go see him? He won't be able to talk with the breathing tube in, but
Yeah,
no,
we'll wait in the waiting room.
Wow. Okay. That's interesting.
Yeah.
They want to see her husband or their dad. Maybe they still want to see him like that. But
Yeah, I don't know.
Doing okay, kid?
Oh, yep, I was just checking something. I should get back to work.
she's like wound up so tight.
Yeah.
Dr. King.
None of this was supposed to happen.
You want to share how it was supposed to go? You stole an ambulance.
Haven't you ever done anything stupid?
Well, I think the spectrum of stupidity, yes, we've all done something stupid, but not many people have stolen an ambulance and crashed it. That's,
It was just supposed to be a joke. Now we're going to jail.
I mean, what do you think would happen for stealing a vehicle in an ambulance?
well, that's kind of what Dr. Robbie said, underdeveloped prefrontal cortex, so not really acknowledging consequences.
He was the quietest baby. He slept through the night. It was perfect.
I'm so sorry for your loss.
He was a wonderful son.
That's why they didn't have any more. I'm just kidding.
That's deflection.
Would have been a great man. I can't believe this is happening.
Well, they had to make up
Can you
for
tell
last
us what
episode.
happens now?
I can walk
Yeah.
you through all the next steps.
Yeah.
But
But
are we
he hasn't got. Oops.
are we finally going to see Dr. Robbie break down?
What about Whitaker getting sprayed with something? We haven't had that yet.
Yeah, that's true.
Did I miss something? I dropped a scalpel and it stuck into Garcia's foot.
Oh, that's bad.
It might actually be worse than fainting. So.
Yeah. It's like, yeah, that's way worse than fainting.
Well, at least I didn't kill anyone.
The day's only half over.
It was actually not his fault at all.
He wanted to be an organ and tissue donor upon death.
I don't want to talk about that. No, he was too young.
He was 18.
You didn't know him.
It's so hard.
Yeah.
$150. I'll bail you to rest.
$850, man.
Man, we have a lot of people putting
Yeah.
on that.
What's in the differential diagnosis for male gynecomastia?
Definitely alcoholism, but then there's pituitary and gonadal tumors or pathology.
He was drunk. That's why they would want to come back.
Yeah, and low. She mentioned it, but most common thing I see cause gynecomastia is low testosterone. Gynecomastia is breast tissue and and a male.
Okay.
Who do we have to thank?
I don't know. I think there's a card
Oh,
on
that
the
is
back.
from that like
Enjoy your
management
lunch.
team.
Shelby Adams, Dr. Adams' sister.
Oh, okay. Yeah, I misread that completely.
Yeah.
Feel free to bring the Dr. Robbie back.
For another dance.
Paninis and watermelon salad.
That sounds delicious.
Are you coming to get me?
Yeah, remember I'm coming to pick you up after my shift.
Okay, so there's some parallels there with Mel and then the abandonment patient.
caregiver. Yeah.
Where's Christy?
She's using the bathroom.
Do you think Dr. Collins gave her, instead of giving her nausea medicine, gave her...
No, I can't imagine she would have done that. I mean,
Out of
Gonna
here!
hit her.
Hey, ladies, that's enough! She is my daughter! Step away from my chimp! That's enough!
Wow.
I thought when she pushed her that she was going to get hurt.
Yeah, that's going to maybe cost her the baby.
Yeah.
All right, episode 6 down. Any, I don't know, glaring thoughts?
I've been looking forward to episode 7, just more Dr. King.
Yeah.
But, I mean, it was sad with the son and he's brain dead.
Yeah, I mean, I figured, well, we kind of talked about it before the episode. We figured they'd bring back some sadness.
Yeah, they have to.
Gotta tug at those strings. So now we're kind of on the topic of organ donation. Can be a pretty hot topic, pretty polarizing topic for some. So we'll see how that ends up coming out. I didn't write down a ton of stuff for this episode. I wrote down a few notes. I mean, the thing that obviously kind of bothered me initially, the administrator coming down, again, talking about all these metrics, these scores, bringing in these consultant groups or management groups to, at the end of the day, the objective is to increase profits, optimize profits.
That's not how they present it, though.
No. So you're right. In real life, it doesn't tend to get presented like that.
Mm-hmm.
It gets presented like, well,
Trying to better the outcome for the patient.
Yes, if we do this, it will improve outcomes. If we do this, it will improve XYZ, which are all things that everybody in the world of healthcare agrees with.
Am I wrong? But are patient satisfaction scores connected to the amount insurance companies will pay to the what's that called? The system.
There's definitely some reimbursements tied to patient satisfaction, which, look, if you ask me, is one of the dumbest things that can be done from a healthcare perspective. I'm not saying that satisfaction isn't important.
Oh yeah.
And I'm not saying that customer service at any level isn't important. It obviously is. You want to provide good care, appropriate care. Like the one patient in this episode who was so grateful, so thankful. Dr. Collins she was, she did her job. She did it well. She did it with, she had a good bedside manner about it. Like that. Yeah, the complete package is doing it in a way that does optimize patient satisfaction. Also, this is where it gets really tricky because there can be something that's not appropriate. Like, let's say a patient may want something that's inappropriate or something that's dangerous to them. And if you say, no, that's not appropriate, we can't do that, then obviously that's you challenging them. You're going to get a bad score. Now, I guess you could, the other side of that would probably say, well, we have to restructure the way we communicate these things in order to soften it a little bit so it's not taking an adversarial approach to it. And I don't disagree with that. I mean, that's all fine and dandy, but real life is messy, obviously. Real life gets tricky. And so this is, I struggle with this because this is always something that comes up in healthcare. And I understand it's, at the end of the day, it's a business, but I don't refer to patients as customers, right? Yeah. Like, there are people in the healthcare world who do. There are administrators who will. And I guess at the end of the day, they kind of are. I mean, they're consumers. I don't know. That's not really the oath you take. That's not really the position you take as a provider. So that's a challenge, and Dr. Robbie obviously challenged them in that.
And they didn't like that.
They didn't like that, so then they offered to give him a higher paying job so that he would fall in line. So,
oh, that's just crazy.
Yes. So let's...
so that he would help everybody else fall in line too.
Pretty much, yeah. Yeah, and that
but that's just corporate.
Yeah.
That's just corporate, any job.
Exactly. Yeah, no, I agree. That it's not isolated to healthcare.
Yeah.
It's unfortunately, it's a pervasive thing.
That's why they call it corporate greed.
That's right. So anyway, I guess enough on that because we could go all day about that.
Yeah.
And I don't want to get too far in the weeds. Yeah, kind of going back to the whole Mel and the caregiver run out here. We don't know exactly what happened. We actually don't know if there was true abandonment here. But did you pick it up there at the end when she was talking to her sister when she said, "Are you coming to get me?" And she said, "Yeah, remember after my shift." I don't think she is. I don't think I think.
Oh, I didn't pick up on that.
Yeah,
I thought. Okay.
Yeah, I think that's sort of what was told to her, to the sister.
Oh, that's sad.
Obviously, Mel
because she's struggling with it.
Right. Obviously, she's extremely involved. But yeah, so I think that
But this is where she's taking some time for herself, which is what she told the mother or
Sure.
the daughter to do. Is it's okay to take. So she's trying to justify that, which is fine. Like but she can't explain that to her sister either,
Sure.
who's probably not cognitively able to understand the complexity of that.
For sure. So I
So I
think
had to lie to her.
Yeah, essentially. So there's a parallel there. So when I said there's a parallel, that was why it was more than just being a caregiver for a sister.
Yeah.
It was the parallel of perhaps even feeling a sense of abandoned or that she abandoned, or struggling with maybe the sense of that.
Guilt.
Yeah, exactly. So I guess we'll see how that transpires. We'll probably learn more about that. But no, that's telling someone that they need to prioritize themselves is not wrong. Now that doesn't mean completely just abandon all of the responsibilities.
Yeah.
Obviously, that's not what we're referring to. But I always kind of use this example because obviously in primary care I see this all the time. Patients struggling with taking care of a sick or an elderly relative or whatever. They're just juggling 5 kids and all that. And I always kind of say, look, there's a reason when you're on a plane, when you get on the plane, they do the safety protocols in the beginning. There's a reason that they say if the cabin loses pressure, those masks are going to drop out. You need to put yours on before helping the person next to you, right? They always say that. And of course, when we're on a plane, we typically ignore the safety brief, but they always say that. And so I'll use that example when I'm talking to patients, and I'll say, there's a reason that's said. It's because you are no good to anyone else if you are not taking care of yourself.
Mm-hmm.
So I do think it's important to do that. It's important to try. It's easier said than done, I know.
Especially because she said that she is the only one.
Right.
So when Dr. King told her that, or maybe she had planned on it all along. I mean, or maybe not. Maybe she was like, maybe she doesn't plan on abandoning her. She's coming back. She's like, I'm just going to take some time.
Yeah. Maybe she went
safe.
Maybe she's asleep, right? I mean,
Yeah.
we're only
maybe she went out with the car and slept.
Like we're only at noon, right? She came in at 11 o'clock or something, 10 o'clock maybe. I can't remember how long she's been in the ER now, but in the big picture, it's only about 2 hours, and so it's possible that she just went and found a place to go sleep, get a good rest. I mean, so anyway, we'll see how that goes, how that comes back to us. I did write down again, like they've had this several times now, these very difficult conversations when you're meeting with a family, telling them that their son's brain dead. There's no way to simulate that. There's no way to practice that. When I was training, we tried, and so
you did?
Yeah, we tried. So we would have these exercises where they actually brought in actors, like real paid actors,
not famous
actors,
not
but
A-list actors.
Not yet. I don't know. Maybe some of them did, but like local theater.
Maybe if you went to Harvard or something.
Oh, maybe, I don't know.
They would have.
Maybe they would bring in
resources.
I don't know, or maybe it was just the notoriety of coming into Harvard. But I think they would bring in like local actors, probably part of some local theater groups, and they would play they would play a role, and you would have to have difficult conversations, and sometimes it was like a sad thing, like you had to present bad news. Sometimes it was like you made an error, and you had to like tell them about the error. And then I think, oh gosh, there was a few, like our diagnosis or angry patients, like somebody going crazy because we wouldn't give. I remember this one, their relative like IV pain meds or something, and then they were going irate or something. So you had to deal with all these different emotions, right? Simulated, and that's the struggle. Is like you can practice, like you can you can try to develop your own sort of protocol for how you might traverse that, but nothing simulates the real thing. And especially too because we would be talking about something that we weren't involved with. So it's like, okay, like I'm telling you about an error that was committed, but like we didn't, like there was no prior context, and so these things can get, they just become a little hollow. Yeah. But I remember actually this was funny, and I won't mention him by name, but one of my fellow actually this was in residency. One of my fellow residents, smart as a whip guy. The case that we were talking about was a lung cancer case where this particular patient basically had exhausted all treatment options, and to the point where treatment was no longer an option, it was no longer effective, and you sort of had to have this conversation that essentially the next best course of action was going to be more in like hospice, because we were reaching that point where the patient was declining and all of that. And it was funny. Well, it wasn't funny, but it actually kind of was when you think about it, like the big picture. So this resident, right, again, it's very, very smart, actually is now in the field of pulmonary and kind of critical care. So this is right up his alley, right, like lung, airway. And he goes, and his job is to kind of present this to the patient. And so then he starts asking the patient questions about the treatments that they've tried. And of course, the actor didn't know because that wasn't part of the script.
Oh, this was an actor. This wasn't a real.
Right. No. This was a simulation, and that we were in the other room with like the mirror, like that you could see in.
You could see what they're doing. Okay.
So we were like in there watching because you learn from each other, and so no, this was a simulation. So this started asking questions about the treatment, and was like, well, I think I see the problem here. I don't think you've been appropriately treated. He's like, we need to get you to, I can't remember what center who specializes in this. Like, we have a real shot at this. But he was sort of being serious. Like, he wasn't making a mockery. He was just saying, look, like this, basically he was highlighting that this script was inaccurate, I guess. Oh. And like there were holes in it, and that he was like, no, like we have a real shot at this. And so that didn't go well with our program directors. They were like, what are you doing? Like, could you not just do the exercise? He was like, not when I felt like there was a chance. But like, I respected that. Right? I respected that. But anyway.
Well, that should be real life, right?
It should be, yeah. And you should, like, that's the thing. You're not there to act, right? We're not, like, I'm not an actor. He wasn't an actor. Like, we're not there to act. We're there to do what we feel like is appropriate. So anyway, that was kind of funny. At least interesting. Oh yeah, I wrote down, I was like, what did I write here? It was a close call with the needle stick, because you had asked if I'd ever thrown a scalpel at anybody. No, have never, thankfully, never even come close. But I do remember I was assisting in surgery. This was actually when I was a med student. I was assisting in a surgery, and I was gloved in, and it was a tight area, so I was helping with retraction. And I can't remember. I think the surgeon actually wanted me to hold pressure, like on some tissue. I don't know if it was. I don't think it was a blood vessel, but that's typically why you would hold pressure to reduce bleeding. But so I was in there, and he was doing hand sutures. So he was throwing hand sutures, which all that means is instead of using instrumentation to do your knots, he was using his hand. But he was flinging that the needle around, like the hook of the needle. And he just kept flinging it. It kept landing on my hand. It kept landing on my hand. And I'm like, I mean, he knows what he's doing, but like, now it never thankfully landed on like a sharp spot or penetrated the gloves or anything like that. But I'm like, okay, this guy's getting a little too it's a little too, I don't know, cavalier about this. Yeah. But anyway, so I don't know, that jogged that memory. That was from like my second year of medical school. Anyway, yeah, no, I think that was all I wrote down. I don't know if you had any other comments.
No, when you were talking about not pretending, the simulations and stuff, it reminded me of when we were kids.
Oh yeah.
Growing up. Yeah. This is gonna sound weird, but it was not weird. How old were we?
We were, oh gosh, we couldn't have been older than like 7 or 8.
Okay, and then your brother was what? He's 2 years older.
Yeah.
So his brother we used to play in the neighborhood.
Yeah. So background that like 10 seconds. So we grew up like two doors down. I think we kind of mentioned this in maybe one of our prior episodes, but we grew up like 2 doors down. We started dating at like 13. Yeah. So we've been together forever.
Anyways, your brother, my brother. Yep. They would ride their bikes down the street, going woo woo woo. Yep. Paramedics. I was always the patient because I was the smallest. Yeah. And we used my dad's what are those called that goes under the cars?
Yeah, I don't know, but like
whatever. It's like a board that you lay under the car.
For mechanics, like mechanics would use.
So that was our stretcher.
Yep.
And my cousin Lucy, who we're still best friends, she was a nurse, right? Which she is not a nurse, but she is a
So I mean, there's some parallels there.
Yeah, there is. But anyways, Chad was a doctor.
Yeah, I was always the doctor.
Yeah.
You were the patient.
Which I did not want to play, my whole life.
So, yeah.
It was just because they could carry me. That's why I was the youngest.
So the irony of the story is, like 8 years old, I was playing doctor. My brother, who was playing paramedic, is now a paramedic, fire chief. Lucy is now kind of in that treats patients, maybe not as a nurse, but does deal with patients in the dental world.
I'm still the youngest one.
Yep. But yeah, I know that has to be kind of prefaced because it's like we played doctor patient, but that sounds a little weird. Like
I know
we were kids.
People get weird.
There was nothing nefarious going on.
I don't remember. Do you remember? I just remember being carried.
Yeah,
that's all I remember.
Yeah, we didn't
have phones and tablets and all that stuff. We played outside.
That was like
drank water from the garden hose.
Yeah, those were the days where I know it becomes cliche to say, but those are the days where you were outside from dusk till dawn, or I should say dawn till dusk, and then you didn't come home till the porch light went on, all that stuff.
But do you remember cases? Did your brother come in presenting a case?
No, I don't think so. I think we just kind of acted. It was probably like a trauma or something.
I know.
They fell off their bike, injured their whatever, had to do a clavicular reduction in the. I'm not kidding. No, we didn't do anything like that. But yeah, those were fun times.
Yep. All right. Well, look forward to the next episode.
Yep. All right. We will get back at that soon. Until next time, take care.
See ya.